Another thing is, if the embryo even implants on the uterus, the fibroid is a mass that may even be taking up the blood supply and disrupt the blood supply to the embryo. That in itself is another way in which fibroid can cause infertility. The already implanted embryo doesn't even have access to blood supply, and before you know it, the embryo is gone. So fibroids have been known to cause pregnancy wastage. That is because of a lot of these factors that I have mentioned earlier. So there is an Hi everyone, welcome to my channel. It's Dr. Judith Ebengho here. Today we're on another episode in the series on infertility. Today we're going to be talking about uterine fibroids. What are uterine fibroids? Uterine fibroids, simply put, are just benign growths. Benign means non-cancerous growth in the muscular layer of the uterus. The muscular layer of the uterus is known as the myometrium. The uterus actually has like three layers. We have the perimetrium, that's the outer layer, the myometrium, the muscular layer, and then the endometrium, which is where menstruation comes from. But when we're talking about uterine fibroids, we're talking about growth within the myometrium, that's the muscular layer of the uterus. The cause of uterine fibroids is largely unknown, but there are certain risk factors that have been identified. For example, race is one of them. The black race, that's African women, women of African descent, we are more at risk of uterine fibroids, and we are 2 to 3 times more likely to have uterine fibroids compared to the Caucasian race. And also, another thing is that we are also more likely to be symptomatic from uterine fibroids compared to other races. Another risk factor for uterine fibroid is nulliparity. What does this mean? It means a woman who has never been pregnant before. So usually, if you've never been pregnant before, you are more at risk compared to someone who has been pregnant. Another risk factor is obesity. So if you're obese, you're overweight, you're more at risk of having uterine fibroids. Another risk factor for uterine fibroid is age. So usually it's found within women of reproductive ages from 30 to 50. The incidence of fibroid reduces after menopause. So age is another important risk factor. Another one to talk about is the lifestyle adopted by a person. So if you eat a lot of red meat and food diets low in vegetables and fruits, then you're more at risk of developing uterine fibroid. But like I said, the cause is largely unknown, but we've just identified a few risk factors that may predispose someone to uterine fibroid. So now, what are the symptoms of uterine fibroid? It's also worthy to mention that not everyone with uterine fibroid would have symptoms. Uterine fibroid is seen in about 40% of women. Yeah, it's quite common, but however, only like 25% of those women would have symptoms. So what are some of the symptoms of uterine fibroid? Menstrual disturbances like irregular periods or heavy periods, things like that can be identified in someone with uterine fibroid. Another thing is pain. Sometimes there may be abdominal pain. It's also worthy to note that there may be abdominal swelling. So there may be a palpable mass, or you may be able to touch a mass in the stomach of someone with uterine fibroid. Sometimes people even think that they're pregnant. I've seen people that have like uterine fibroid swelling up to their belly button. So, and the mass just progressively keeps increasing in size. So you can also find out, and since this mass is increasing, it causes a lot of discomfort. So it's not unusual to find some form of discomfort, especially when trying to use the toilet, or even it may even make some people develop urinary symptoms like urinating more frequently than normal. Also not being able to hold their urine and things like that, because this mass is pressing on the bladder. So there are a lot of things you can find with people with uterine fibroids. Down to the big one, how does uterine fibroid even cause infertility? First, uterine fibroid may cause a distortion in the uterine cavity. So normally there's a normal shape of the uterus. If there's a fibroid, it may lengthen the distance within which the sperm has to travel to locate the egg, and if the sperm is traveling a longer distance, it may eventually not even get to where the egg is. That can cause infertility. also grow and block the entrance of the tube into the uterus, and when you have that, the egg cannot even meet the sperm, so that may cause infertility. Another factor to consider is when the fibroid distorts the endometrial cavity, that's the lining of the uterus, the already fertilized embryo may not be able to implant on the uterus also. So if there's no implantation, there's no pregnancy. That's another way in which this can happen. Another thing is, if the embryo even implants on the uterus, the fibroid is a mass that may even be taking up the blood supply and disrupt the blood supply to the embryo. That in itself is another way in which fibroid can cause infertility. The already implanted embryo doesn't even have access to blood supply, and before you know it, the embryo is gone. So fibroids have been known to cause pregnancy wastage. That is because of a lot of these factors that I have mentioned earlier. So there is an increased risk of pregnancy wastage when you have an individual has uterine fibroids. So generally, fibroid increases the risk of miscarriage because the normal anatomy of the uterus is distorted by these uterine fibroids. So I'm sure you're thinking, how do I know I have fibroids and all of that? To really confirm that what you're experiencing is uterine fibroid, you do not just go on Google and look at your symptoms. It is very wrong to do that. You have to present at the hospital and get properly evaluated by a specialist. There's a series of tests that they would run and then tell you, what you may be experiencing may be uterine fibroids. So down to the big one, how do we even manage uterine fibroids? There are different methods of managing uterine fibroids. First, there's the part of the management that is called the watchful waiting. So this is when you don't really do anything, you just keep following up the woman and evaluating the uterine fibroid. And you do this when the woman is not symptomatic. So we know that 40% of women would have uterine fibroid, but only 25% would have symptoms of that uterine fibroid. So the other 15%, if they don't have symptoms and the fibroid is small and everything, you may just want to watch. There's really no need to prefer any intervention when there is nothing, there is no symptom being experienced by this woman. Another aspect with the management of uterine fibroid is medical management. This is when you use certain drugs to help alleviate the symptoms, like pain medications, or give some hormonal drugs that help to manage the period irregularities and all of that. Or there are even some drugs that may be given to induce menopause, but that one is particularly, the side effects are really much, so they may not be the first option that would be adopted by your physician. But all of this, you really just have to get properly evaluated, and the best option for you would be preferred by a specialist. Then last but not the least are the surgical options available for the treatment of uterine fibroids. And there are different things that can be done. There's a uterine artery embolization, there's endometrial ablation that some people even do. This is to help with like the bleeding. But there are two major ones that we like to talk about, especially in this environment. That is the myomectomy. Myomectomy is usually preferred for women who still want to preserve their fertility and they still want to be able to get pregnant in the future. So in those type of women, you want to, myomectomy just involves removing the fibroids themselves, taking it out, and this in itself would help alleviate the symptoms. But mind you, with myomectomy, it's really important to note that there is a risk of recurrence, and there's a 27% risk of having the fibroids grow back within 10 years. So do not be surprised that when people remove the fibroids the first time, they may go on to also develop uterine fibroids subsequently. The definitive management, this means that we have ended the chapter, we've closed everything that has to do with uterine fibroids. The definitive management is the hysterectomy, and this is surgical removal of the uterus. There are different types of hysterectomy out there, and usually this is offered to women who they don't want to preserve their fertility, people who are done with childbearing and stuff like that. So an hysterectomy is done, and with this option there is no risk of recurrence because the uterus is removed totally. So that's that about uterine fibroids. If you have any of the symptoms, you definitely want to speak to a professional. Do not go online to Google your symptoms. the things you find online would only just scare you more. So just see a specialist. You're better off knowing than not knowing what is going on with your body. Do not forget to like, share, subscribe, leave a comment for me. Let me know what you want me to talk about in this series, and you may just be lucky I'll pick that topic and then talk about it. Do not forget to share this video with people who need it. There are a lot of women out there who need to hear these things, who need to be empowered on what to do, and you just sharing this video may just be your own way of helping them and contributing to their overall reproductive health. Till I come your way next time, I'm Dr. Judith Ebengho. Stay tuned for more episodes on this series. Bye.